Hey guys, Dr. Dave here. Have you ever had a sore neck, shoulder, arm, back, or hamstring while playing pool? I sure have. With me today are sports and occupational therapists Brad Ott and Kevin Rhodes to give us some advice and share some expertise related to common pool ailments.
My team at Rebound Sports and Physical Therapy has spent over 25 years diagnosing and treating overuse injuries of almost every sport you can think of.
And while Brad tends to focus on back, neck, and pelvis issues, I specialize in shoulder, elbow, wrist, and hand issues.
This is part of a 3-video series covering the top 10 physical ailments pool players experience. This part covers shoulder and elbow issues. With the elbow held high in a low stance position, the triceps, deltoid, and other muscles in the upper arm and shoulder can get tight and fatigued over time. There is no acceptable technique change to eliminate this issue, but there are good stretches to help you deal with it.
Dave, what I think I'm going to have you do first is put your right hand on your left shoulder for me, and I want you to point your elbow straight ahead. Beautiful. Now I'm going to have you use your left hand, cup it over your elbow, and I want you to pull your hand so it shoots off the back side of that left shoulder, and you should feel a nice good pull right through this range, right through here. Again, when we're holding these stretches, I want to hold for about 20 seconds, so we're getting a nice expanse of that tissue, so that when you let go of the stretch, that tissue doesn't come back to that tight configuration. Make a fist. With that right arm, you're going to use your other hand, you're going to cup your fist, and what I want you to do is you're going to bring your hand towards your shoulder, and I want you to use your elbow, and you're going to pretend that you're scooping or digging in the sand, and you're going to push that elbow away from your body. And again, as you get that elbow far away, you should feel a nice tug on the back side of that shoulder, maybe even a little bit of pull through the back side of that tricep. And again, let's hold that for about 15 to 20 seconds to again allow that tissue to really spread out. One last thing that we like to do to help these tissues out is use a foam roller. Now there's a wide variety of ways that you can do it, but for this particular one, we can take a small roller, put it on a wall, right? And Dave's just going to use his body weight leaning into it. And as he rolls up and down, one good thing that you can do is kind of change the orientation of that hand, go into a palm up, palm down position as you're kind of rolling, getting a slightly different area of a roll on those tissues, the deltoids and the tricep, and even a little bit of that bicep in there. That increases some blood flow. Blood flow increases the nutrient and healing properties that are carried to those tissues. And if you don't have a foam roller, another item that you can use is a ball of some sort. Here, Dave has a little spiky ball from a therapy place. You can also use a tennis ball, a baseball, a lacrosse ball, something like that. But again, you can put that on the wall. Again, use your body weight to kind of trap it in there, put some pressure on the sore musculature in the back side of that shoulder, and just kind of roll around on it. There you go, like a bear against a tree. You're just getting some good blood flow into those tissues.
If your weight is too forward in your stance, and you apply too much downward force on the bridge hand, you can irritate the tissues in the shoulder.
As Dave is leaning forward, he's got too much of his weight forward, which is pushing the upper arm bone up and into that shoulder, which is again impinging on some of these soft tissues in here. All right, so what I have here is an anatomical model of the shoulder. This is a right shoulder. If I were to tap you on your shoulder, I'm tapping right here. This bone is called the acromion, and it's essentially the hood or the roof of the shoulder. Your upper arm bone comes right up and it fits right underneath that space, and then you have some musculature that kind of comes through there under the acromion and then on top of your upper arm bone. So when Dave was leaning forward, that arm was coming out and up and getting pushed up, pinning the muscles between the top of the humerus and the bottom of that acromion bone. Prolonged time there or prolonged pressure there can really pinch those tissues and cause inflammation, swelling, and long-term pain.
You can mostly prevent this by changing your stance to get the feet more forward with your weight more balanced between the feet. There are also good stretches to use if you have discomfort in the shoulder.
So my favorite stretch that I like to give for shoulder impingements is a manual subacromial decompression stretch. Essentially what we're doing is we're pulling that upper arm down and out of that cavity, which is going to decrease the amount of pinch that we're getting on those tissues. So here, Dave, I'm going to have you hold on to the edge of the chair, right? And I want you to try to relax that upper arm, and you're going to lean your entire body to your left side, right? And as you lean to your left, you're going to feel that upper arm bone get pulled out of that socket just a little bit, relieving the tension, relieving the pressure on those tissues. Again, hold this about 15 to 20 seconds to really get an expanse of those tissues.
If you practice lots of power shots or use them often in your game, you might develop some elbow discomfort. This can sometimes be worse for people who keep their shoulder and elbow still during the stroke because this results in the elbow joint being flexed with force. One obvious way to reduce the stress on the elbow joint is to allow the shoulder and elbow to move during the stroke, but this can be difficult for many people to do with accuracy and consistent timing, especially under competitive pressure. You just need to be careful to not drop the elbow until after the hit. Here, I dropped it a little early, causing the tip to rise a little before the hit, giving me much less draw than I expected. If you have elbow discomfort, the stretches we used for the shoulder and upper arm can also be used to provide some relief since they stretch the triceps that attach into the elbow. Be sure to watch the other 2 videos in the series for help with other common pool player ailments. We hope the advice and demonstrations help you experience less discomfort and allow you to play our great game for many years to come. If you're having trouble with any of the ailments, you can do the pertinent exercises and stretches as a warm-up routine before playing. You can also do some of them when playing while waiting for your turn at the table.
Okay, a couple things to remember. One size does not fit all with these stretches and exercises, but give them a try, see how your body responds, be consistent with them, and see if it can help prolong your career, improve your play, and make your body feel better.
Rebound Sports and Physical Therapy has over 25 years of experience helping athletes in many different sports. If you want individualized help with the pool ailment, or for more information, visit the Rebound link in the video description. And as always, good luck with your game from Dr. Dave.